Welcome to this episode of Here's Something Good on women's health and longevity. We are so grateful for our partners, P&G and Walgreens. Together, we're bringing you something good each week on women's health, and it wouldn't be possible without their support. Each week, we aspire to bring you the good news on women's health by talking to renowned scientists and medical experts, and by sharing health advice that can help you live healthier and happier. Last week, we talked about bladder leaks, the minor loss of fluid that so many women experience at one time or another in their lives. Today, we deal with heavier leaks, and we brought back Dr. Karen Koffler. Dr. Koffler is an assistant professor of medicine at the University of Miami School of Medicine and a physician at Lifespan Medical, with an emphasis on longevity medicine. She also has her own private practice focused on women's health and longevity. Welcome, Dr. Koffler. Thanks for being with us.
And thanks for having me back again.
So we're talking today about heavier bladder leaks or heavy incontinence. And I think it's a really important issue because it's really more common, I believe, than people think. Is that true?
It really is. You know, at least 50% of women over the age of 50 have some degree of incontinence. And some of them, it can be pretty substantial. So it is, if you think about 50% of the women over age 50 are suffering from some degree of incontinence. That's a very large number.
Yeah, that's probably more than people realize, which means that sort of somebody you know is dealing with it, if not yourself. So why is this the case? What causes this heavy incontinence?
There's a fair number of reasons why women develop incontinence. And again, it's not just limited to older women. We do know that up to 20% of women 18 and older experience some degree of incontinence. And there's a variety of reasons. But as we age, we see the loss of estrogen affects the tissues in the pelvic floor, just as it affects tissues throughout the body. If we gain weight as we age, that can increase the pressure on the bladder. The tissues weaken just in general as we lose muscle mass with age, but also if we've had children, if we've had surgery in our pelvic region, the tissues can be weaker. They can be there can be stretching, a laxity to the tendons and ligaments as well as the musculature in that region. All of which changes how well we can hold on to urine and can result in incontinence. So there's a variety of issues at play.
And when we say heavy incontinence, what do we mean by that?
Lighter incontinence is a couple of drops, and heavier incontinence means a great deal more than that. And the bladder itself can hold about up to 500 cc's of fluid. So that's like a quarter of one of those big soda bottles, or maybe better understood as 2 cups of urine is what a typical bladder can hold. And if you lose more than a few drops, if you lose a half a cup, that's considered to be heavier incontinence. And it can be quite debilitating for women.
What kind of physical and emotional challenges does this pose?
When we reflect on our kids, we always changed our kids' diapers quickly when they've peed because we want to make sure that the urine is not irritating their skin. So it can be irritating to the skin. It can be, emotionally, it can be quite upsetting because it can come completely unexpected. It can obviously show through your clothing if you wore it white or beige or something obvious. And it can also really disrupt a woman's confidence. It could make her feel quite limited in what she can do and where she can go and how long she can be out. So it can alter her life and actually lead to a quality of isolation.
But it doesn't have to be that way. I understand there are things we can do and that all of us need to know about because it will likely happen to many of us. So what are some of the things we can do?
Right. And I think that's really important because I think a lot of women sort of just deal. And the reality of it is we've advanced a great deal. There's a whole field in physical therapy called pelvic floor physical therapy, and they do incredible work. They teach you how to pay attention to the bladder, to the pelvic floor as well as the core, so that you can begin to control those tissues and strengthen them. They'll use things like biofeedback to help achieve that. There are other devices that they use, very sophisticated in terms of weights to help ensure strength in that region. Things like Pilates, which help you focus on the core, as well as yoga. They even have the Mula Bandha in yoga means root and strengthening the root. So and obviously that's an ancient practice. So it's clear that this has been an issue for a long time. There's practical things you can do. There's a variety of absorbent pads all the way through in underwear, all the way running the gamut, depending on the degree of leakage a woman experiences. There's more sophisticated techniques like surgical techniques or ways to bulk up the ureter, the urethra, so that that's stronger and can endure more. There's bladder retraining exercises that are very, very effective. So there's a whole variety of ways that this can be addressed today.
Which is great. It's really great to know because I think, again, knowledge is power in this kind of environment, and sort of knowing, A, that you're not alone, but B, that there's very practical things you can do, from the exercises that you talked about to the right kinds of product and pads and liners. But also, as you said, in some instances, people need more medical help, and that's available too. But on a day-to-day basis, if you want to, we don't want to be curtailed in our activities, obviously. And I think that that's why it's so important to have these conversations. On a practical level, what would you tell women who are facing this today and want to sort of do something about it today or tomorrow?
Practically speaking, planning your fluid intake, just the way, when I travel, I sort of plan my meals. Or if I'm going out to eat at a restaurant that maybe doesn't have the full selection that I'd be looking for, I look at the menu beforehand and sort of get an idea of what I'd probably order. Planning goes a long way. So if you know you're going to be out for a while, you can certainly take in your fluids earlier in the day and allow it to sort of taper off as you get within a couple of hours of being out and about. So that's very practical. Again, don't be ashamed to look for the right pad absorbency that works for you. And some of these are quite excellent. The way they're constructed, they really are far more absorbent than anything that has existed before. So I think the whole industry is becoming much more aware that this is an issue, and they've created a variety of pads for different degrees of leakage. Wearing appropriate clothing, patterns are probably best. Learning to take a change with you just in case on the outside chance. So those are just some very practical tools that you can use to be able to maintain your life and not see this as, some sort of personal flaw, but recognize in many ways this is part and parcel to aging. And, many of us have things that we have learned to work around and continue on doing the things that we love. And this is another one of those health issues that we can learn to work around.
That's why I love talking to you so much. Just be able to share these things and know that it's, again, that none of us are alone in this, and that this is very normal. We talk about normalizing conversations, but I think this is so, so important. And I know a lot of people are suffering in silence for something like this, which is pretty easily addressable. So really appreciate your time, as always, and look forward to having further conversations.
Great to be with you again.
Here are the top takeaways. First, know that you're not alone. Heavy incontinence is not a personal flaw. It's a common occurrence as we age due to factors like childbirth, hormonal changes, and muscle loss in the pelvic region. Second, heavy incontinence is very treatable. Core strengthening practices like pelvic floor physical therapy, Pilates, and yoga can all make a real difference. Lastly, You don't need to restrict your social life because of heavy incontinence. Today's products can effectively meet a variety of absorbency needs. With a little planning and the right products, life can go on as usual. Thank you for listening, and please share today's episode with others in your life. Have a great day. For more podcasts from iHeartRadio, check out the iHeartRadio app, Apple Podcasts, or wherever you listen to your favorite shows.